Hi, Dr. Harrison here, and today I want to talk about a very important part of my practice, and that is the functional medicine portion of my practice. Most people ask, well, what is functional medicine? Functional medicine is a patient-centered approach to evaluating that patient, really digging into their history to try to discover what it is that has broken down in the body that's driving their complaint or their symptom or their diagnosis. Maybe they're hypothyroid, maybe they're type 2 diabetes, irritable bowel, celiac disease. Most of these conditions are autoimmune, but these problems usually develop not because of an excess of something or something's been added to the system, but something's been lost in the system. Something is broken down somewhere. So we need to do a real thorough history, always looking upstream to try to find out, well, what's driving this condition in these patients. Bottom line is the majority of these patients are autoimmune, and autoimmune has a lot to do with your digestive tract because 80% of your immune system lies within the digestive tract. So most often we're going to find gut issues with these patients that's driving inflammation in the body, and by inflammation we're not talking about tendinitis or bursitis. We're talking about inflammation on the cell membranes that is affecting their ability to get the good stuff into the cells and detox or get the bad stuff out of those cells. Not to mention, when we have inflammation on the cell membranes, we also have a blunting of the hormone receptors, which causes them to not be able to hear the hormones. So very, very important that we repair the cells at the cellular level most often when we're dealing with these patients. But we need to know, well, what's driving that inflammation? So during that history, we're evaluating, obviously, diet, what types of toxins they've been exposed to in their life. Maybe it's just, sugar, bad fats. Maybe it's toxins, from eating a bad diet. Or even worse, maybe heavy metals they've been exposed to. Mercury fillings in the mouth, lead passed down from mom through the generations. Other exposures, maybe they had a mold exposure or they've suffered from Lyme disease. All these drive massive inflammation in the body. So we're always looking at all these things. And then usually we're going to order very specific blood work that will have markers that we can evaluate to see if it correlates with our suspicions. From there, then we can make a very structured plan on how to help this patient heal. And we've had great success in the office in doing that. Mainly, we're going to start with dietary changes, kind of clean up the diet. Obviously, we have to stop putting the bad stuff in. We can do a great detox program. We can pull out heavy metals and pull out all the toxins out of the liver and, even out of the brain area. But if we are continuing to load our body with toxins, it's going to be a short-lived experience of an alleviation of symptoms. So we want to cut out the sources of the inflammation, then change up the diet, then go through the detox program. And during that process, depending on what's going on with the patient, we're going to have specific supplementation to help repair that cell membrane and get it functioning again. Usually when we do this, we're going to see massive changes. Weight comes off, obviously. Hormones start working better. Hair stops falling out. Blood pressure comes down. We see massive changes in people's health. So it's very, very exciting, very, very rewarding to work with these patients, but it's not always easy. And that's the reason why I don't work with everybody. I only work with people who are really committed to getting well, because what we do absolutely works. But it only works if you follow my directions. So I need to work with people who are committed to working with me, and then we have a win-win situation going on. If you have a condition like a hypothyroid situation, or you're concerned about your type 2 diabetes, or any other autoimmune condition going on, please call the office at 407-522-5858. You can speak with my staff, see if you qualify for a preliminary consultation with me on the phone, or maybe even set something up in the office. I hope this has been helpful for you and explains a little bit about functional medicine, and I look forward to helping you in the office.